Hello, everyone. Let's talk about the craniosynostosis. Uh, what do we understand by this term? As we know, synostosis is the union of two bones, two separate bones, and craniosynostosis is when those two bones get united or gets fused uh, earlier than they are supposed to be. So that means craniosynostosis. There are many few different types of craniosynostosis depending on which suture you're talking about. So before going for the craniosynostosis itself, let's talk about some general anatomy, normal anatomy of your cranium and your cranial vault. So here we can see from the superior view, here we have your cranium vault, cranium, and here we can see your fontanelle. One is your anterior one is your posterior one is your sphenoidal, and one is your mastoid over here located on this side. Um, as we can easily appreciate, uh, the anterior fontanelle, which is present on your anterior side uh, in the infant or in the child, this one is the most is the biggest one, is the largest, and the last one to get closed. So as we can appreciate, this one is in a diamond shaped, like a diamond. So this one is your anterior fontanelle. Here on the posterior side, we can see your triangle shaped fontanelle, which is known as your posterior fontanelle. And here we have the sphenoidal fontanelle, and here is your mastoid fontanelle. Which one? These two of them are. These two are your irregular shaped. So let's talk about the frontal fontanelle, anterior fontanelle. Um, this one gets closed by the age of your 2.5 years. By the age of 2.5 years, and suppose there's an infant, and clinically, if you want to examine the child, suppose there's an increase in ICP, intracranial pressure. If suppose it's increased due to any reason, now then in that case, your this anterior fontanelle will be bulging outside, and it would be easily palpated. So it's a clinical sign one must know, and where to palpate it. Its location is somewhere near to the bicoronal site, where your coronal suture will be. So this one is your anterior. The diameter of your anterior fontanelle will be anterior posterior diameter would be somewhere around 4 centimeter, and your transverse diameter would be somewhere around your 2.5 centimeter. Then let's talk about the posterior fontanelle. This location is somewhere near to your lambdoid and sagittal suture, making a triangle. Where this one is your sagittal suture, these one two of are your lambdoid sutures, and therefore forming of your posterior fontanelle. Now, posterior fontanelle is the one which closes by the age of between 2 to 4 months, and sorry, and let's talk about the sphenoidal fontanelle, which is also your irregular shaped, and this one also gets closed by the age of 2 to 4 months. So it's easy to remember. The posterior goes with your sphenoidal fontanelle. Both of them usually gets closed between the age of 2 to 4 months. And then we have the mastoid fontanelle, again irregular shaped, between somewhere near your mastoid process, behind your retroauricular area, behind your ear, and this one gets closed by the age of 1 year. So the important one are your frontal and your anterior and your posterior fontanelles. Now let's talk about few of the sutures which we can see here. This one is your metopic suture. The metopic suture is the one which is present at the birth, and its role is to separate your frontal bone into two parts. So the frontal bone here you can see is still not united. So metopic suture is dividing these two into two parts. Then this one is your sagittal suture, and here is your lambdoid sutures. Now the role of these sutures is uh, this metopic suture over here, since it is placed sagittally over on this side like this. Its role is to make your cranium goes growth going towards lateral side. So the cranium, the size of the head will grow laterally, because of in the frontal area because of this metopic sutures. Same thing goes with your sagittal suture also. The sagittal suture role is to make your head grow, infant head grow, child head grow laterally. Yeah. The basic principle behind this is the growth of the head is perpendicular to these sutures. So since this is here, the growth will go perpendicular. The growth will be taking place perpendicular to this. That means laterally. Again, for the metopic suture, since metopic suture is placed in the midline over here, the growth will take place laterally. That means perpendicular to the metopic suture. Now, same thing goes with the coronal suture also. Now, here we have the coronal suture bilaterally over here. Now, since this is placed in a coronal fashion, the growth at this level, at the coronal suture, the growth will take place anterior and posteriorly, therefore perpendicular. Same thing goes on this side. Since here is the coronal suture on the right side, the growth will take place perpendicularly. That means in a anterior posterior fashion. Metopic suture, again, if it is placed like this, the growth will take perpendicularly. That means it will take place laterally. Growth will take place laterally, and same goes with your sagittal suture. Since it is placed like this in a midline, the growth will take place perpendicular to this. That means the growth at the level of the sagittal suture will take place laterally on each side, this side and this side. Same goes with the lambdoid suture. If lambdoid suture is placed in this fashion, the growth will take place perpendicularly. That means towards your occipital and the parietal area. So this is the basic principle about the craniosynostosis. One must know how the head grows within the limit of the age. Now, here we can see easily appreciated the anterior fontanelle. Here we can see the coronal suture on this side and the metopic suture on this side. Usually, you can feel a small ridge over here with the metopic in the metopic area. Which will get completely obliterated by as the child grows, and therefore in this picture, as we can see, we can't even appreciate any metopic suture. Just we can see anterior fontanelle, and anterior fontanelle, since it's present in this infant or the child, therefore we can easily uh, make a guess the age of the child should be or would be below age of 2.5 years. Here also a doctor palpating your fontanelle. Now, as I already mentioned, here is your metopic suture dividing your two frontal bones into two parts. Here is your anterior fontanelle. Here is your coronal suture on either side of this anterior fontanelle. And on the posterior side of this diamond-shaped anterior fontanelle, we can see a sagittal suture. And between lambdoid sutures on either side and the sagittal suture in the anterior part of this area, this is your posterior fontanelle. Yeah, and here are two of your lambdoid sutures. And in this picture illustrating your anterior fontanelle, which would be bulging if ICP is increased, yeah, or it can be either shrunk too, depending on the pathology. Now, as I already talked about the different closure ages of these fontanelles, anterior and posterior, and sphenoidal or mastoid. So, anterior one was your basically till your 2.5 years. Your posterior one gets closed between 2 to 4 months. Your sphenoidal gets usually gets closed between 4 months, and your posterior one gets closed by your age of 1 year. So there can be variations too. So now what I talked about as the average closure of these areas. Now here for the clinical aspect, here we can see how these fontanelles are formed. Here is your sagittal suture. Here is your anterior fontanelle. On the either side of your coronal sutures bilaterally, metopic suture present over here. and two of your lambdoid sutures. Then again, age has been described over here, and these fontanelles are very important because they can be palpated in an infant, and uh, therefore helping us with the diagnosis in few cases. Again, this one is about the fontanelle closure. I already have mentioned about these closure ages, and they can get closed. Now, talking about the craniosynostosis, there are different types of craniosynostosis. Um, and one is your scaphocephaly. Scaphocephaly, when we are talking about, we are talking about the sagittal suture. So S for S, sagittal suture, or scaphocephaly can also be called as dolichocephaly. Both of them related to your sagittal suture. Then is your plagiocephaly. The plagiocephaly can be in the anterior part or it can be in the posterior part. If we are talking about the plagiocephaly in the anterior part, we are basically talking about your coronal suture. Uh, and if it's plagiocephaly is present in your posterior aspect, then we are talking about your lambdoid suture synostosis. Then we have brachycephaly. Brachycephaly also itself it can be present anteriorly or posteriorly. If brachycephaly is present anteriorly, again we are talking about your coronal suture. If brachycephaly is present on your posterior aspect, then we are talking about again lambdoid suture. Then we have a trigonocephaly. The trigonocephaly is present uh, related to your metopic suture. That means in the frontal area. And then we have oxycephaly or turicephaly. It's the involvement of more than one or two sutures. Involvement, craniosynostosis of more than one or two sutures. Now this picture again describing about different craniosynostosis, and this one is your normal head, normal cranial vault. This one is your scaphocephaly. That means if scaphocephaly, we are talking about the sagittal suture fusion has taken place earlier than it was supposed to be, therefore causing your since therefore causing your brain head to grow in anterior posterior direction. So, as I already mentioned, scaphocephaly, sagittal suture role is to make your head grows laterally. Now, if the suture gets fused too early than it was supposed to be, therefore the head won't be able to grow on the lateral side, and therefore for the compensation purposes, the head will therefore go and grow in the anterior posterior direction, therefore giving it as aspect of a scaphocephaly. That means a boat shaped head. And you can either call it also dolichocephaly also means narrow shape. So scaphocephaly or dolichocephaly are one of same terms. And then we have plagiocephaly. Now plagiocephaly, here we can see plagio means flattening, unilateral flattening of your forehead, or it can be of the posterior aspect also, occipital bone also. If we are talking about the plagiocephaly on the anterior aspect, we are talking about the forehead. And on plagiocephaly on the posterior side, it can be due to your occipital bone also. And plagio simply means narrow. Plagio means some flattening, somehow flattening and oblique kind of thing. So this here you can see it's oblique. So that causes plagiocephaly. Then we have brachiocephaly, and brachio is almost same like plagiocephaly. Just the difference is brachio is bilateral. So B for B. So it involves both side of the head. Brachiocephaly. We will further discuss about them. Now, trigonocephaly is basically we are talking about the your this metopic suture. Metopic suture is involved in trigonocephaly, so therefore causing a triangle-shaped vertical forehead. So it can be very easily uh, diagnosed trigonocephaly. Now let's go next slide. Again, the same figure illustrating different types of craniosynostosis. Here is your normal head. with your metopic suture in the frontal area, and two bicoronal suture next to your anterior fontanelle. Then here is your sagittal suture, and here is your triangle-shaped posterior fontanelle with the two lambdoid sutures on either side. Now, this diagram is referring to your bicoronal brachycephaly. As I already mentioned, brachycephaly can be off due to your coronal sutures, or it can be due to your lambdoid sutures or craniosynostosis, that is earlier fusion of any of these sutures. But in this figure, we can see in this picture, it has earlier fusion of bicoronal suture has taken place in this picture, therefore causing your brachycephaly on the coronal aspect, on the coronal side. Yeah, we will further talk about them in much more detail later. Then here we can see easily appreciated, there's no coronal suture seen over here on this side. That means therefore this is a plagicephaly on the anterior side, and therefore we can call it um, a coronal anterior plagicephaly or coronal unilateral coronal plagicephaly. Remember, plagicephaly is always unilateral, so therefore unilateral. And brachycephaly is bilateral. Then here we can see the metopic suture. Here, metopic metopic craniosynostosis. Here we can't see no metopic suture. Therefore, your frontal bone has united over here too much earlier, and therefore causing a triangle-shaped forehead. Yeah, due to metopic suture. Then brachycephaly and scaphocephaly, brachycephaly and plagiocephaly can occur due to the lambdoid suture fusion, also earlier fusion. So if it is unilateral lambdoid, here we can see it's plagiocephaly. Plagiocephaly, as I already mentioned, is it simply means oblique or flattening on unilateral side. Therefore, you can see a flattening over here. This is your posterior plagiocephaly, and due to this reason, it causes bombardment of the contralateral part, as we can appreciate in this picture. Then here we can see scaphocephaly. There's no sagittal suture. As we can see, there's no sagittal suture present, therefore referring to as scaphocephaly. And since scaphocephaly, the head will grow into anterior and posterior direction rather than growing laterally side by side. Again, the same thing. Here we can see no coronal suture on this side, therefore it will be a plagiocephaly. And plagiocephaly, as I already said, it would be unilateral and therefore flattening on this side. Here we can see, so we can name it like plagiocephaly, unilateral coronal plagiocephaly, or just unilateral coronal synostosis. It all means the same thing. This one is sagittal synostosis. That means scaphocephaly. There you can't see any sagittal suture over here. Therefore, a head won't grow on the lateral side. Instead, the head will grow anterior and posterior direction, narrowing your head and therefore giving it aspect of a boat. That's why scaphocephaly. Now let's talk about individually about these synostosis. Now let's talk about the sagittal suture. Therefore, sagittal synostosis. Uh, as I already said, there won't a sagittal suture will fuse too early. Therefore, the head won't grow laterally, therefore giving aspect, and instead it will grow anteriorly and posteriorly, therefore giving an aspect of a boat. And here we can see a boat. So this is scaphocephaly. Scaphocephaly is also, you can call it dolichocephaly, interchangeably same thing, because dolichocephaly also means narrowing of the head. So scaphocephaly or dolichocephaly, we are talking about your sagittal suture, remember. Again, here in the same picture, we can see all the sutures are present instead of just sagittal suture is missing, therefore giving it aspect of boat. In this one, you can easily appreciate anterior posterior diameter of the head is much more uh, increase comparatively to your lateral transverse diameter in this case. So sagittal suture synostosis, or you can call it scaphocephaly or dolichocephaly, boat-shaped head. Now let's talk about the coronal craniosynostosis. When we are talking about coronal craniosynostosis, we mean we are talking about the coronal suture abnormality. Now, coronal craniosynostosis can be, again, it can be unilateral or bilateral. If it's unilateral, of course, we're going to call it unilateral plagiocephaly or simply just plagiocephaly. Uh, just we need to mention anterior, because if we don't mention anterior, we can't understand whether it's of coronal suture or whether it's because of your lambdoid suture. So it's very much important to prefix the term coronal or anterior when we are talking about the plagiocephaly. So in this case, coronal craniosynostosis, as we know, as I already mentioned, coronal suture role is to make just opposite to role is to make your head grow in an anterior posterior direction rather than laterally. Whereas when I talked about the metopic suture or sagittal suture, their role was to grow the head into lateral side, yeah, anterior, right side, left side, laterally. And coronal suture role is to, or lambdoid suture role is to grow the head into anterior posterior direction. So here we have the plagiocephaly, flattening on unilateral aspect. So here is the normal one, metopic suture over here, ridge present. Now here we can see the left coronal craniosynostosis. That means this suture, coronal suture on this side, has fused earlier than it was supposed to be, and therefore causing flattening on this side. The forehead has flattened on this side, therefore causing asymmetry. It can be easily appreciated whenever the plagiocephaly is present. Here we can see the bulging of the head on the contralateral side. This is because of your left coronal craniosynostosis. This coronal suture on this side has fused before it was supposed to be, therefore causing the for the compensation aspect the contralateral side to bulge, and therefore causing asymmetry on both sides. So this one is affected, yeah, causing the flattening, other side to be bulging outside. This is your left coronal craniosynostosis on this side. Now, brachycephaly again, as I already mentioned, brachycephaly also can be anteriorly or posteriorly. If we are talking about brachycephaly, first of all, we are talking about the both sides bilaterally. And brachiocephaly also can be anteriorly and posteriorly. If we are talking about brachiocephaly anteriorly, we are talking about the coronal sutures. If we are talking about brachiocephaly posteriorly, we are talking about bilateral lambdoid suture. So no need to talk about bilateral again and again, because brachio means brachycephaly would be would be just talking about your bilateral. So it would be if we say coronal brachycephaly, that means it's bilateral coronal craniosynostosis. If we talk about posterior brachycephaly, that means it's lambdoid suture, bilaterally lambdoid suture craniosynostosis. But remaining on this image, we are talking about brachycephaly of the coronal suture. This one is the normal. We can see coronal suture on this side. Here you can see no coronal sutures. So therefore causing your bilateral coronal craniosynostosis, therefore giving an aspect of flat forehead. Yeah, because since it is bilateral, in this case, in brachycephaly of the coronal suture, we will see flattening of the forehead. Can be easily appreciated. Now let's talk about the metopic synostosis. Now, metopic synostosis, first of all, metopic suture role is to divide your frontal bones into two parts, and it is usually present even at birth, a bit of a ridge, but in this here we can this ridge is much more uh, easily appreciated in this picture, and here this metopic suture has fused too early, therefore causing a triangle shaped forehead. So triangle shaped forehead. As always says, since metopic suture, just like sagittal suture, helps your brain to grow laterally. But since this has fused too early. Therefore, this brain, your head, sorry, will grow anterior and posteriorly, and therefore growing, in this case, growing anteriorly and giving a shape of triangle. because normally metopic suture, just like your sagittal suture, as I already mentioned, will help your head to grow laterally. But since it has fused earlier, there won't be no lateral expansion of your head, therefore causing instead, for the compensation purposes, head will grow in the anterior direction, therefore giving a triangle shaped. So this is metopic craniosynostosis. Now let's talk about the trigonocephaly. Now, same thing, trigonocephaly, we are talking about the metopic suture itself. If there's an early fusion of this metopic suture, it will give a shape of a head like a triangle, therefore hence called trigonocephaly. So here you can easily see a triangle shaped forehead. Here also you can see a metopic ridge over here and triangle. Therefore, it's a trigonocephaly due to your early closure of your metopic suture, or we can call it metopic synostosis. Now, let's talk about the lambdoid synostosis. As I said, lambdoid synostosis also, just like your coronal suture, can have plagicephaly and brachycephaly. If there is plagicephaly, that means we are talking about your unilateral part. And if it's brachycephaly of your lambdoid suture, then we are talking about both sides. Sorry, it's not contralateral, it should be bilateral. So brachycephaly for bilateral, plaggy for unilateral. And since either you can call it lambdoid, or simply you can say posterior plagicephaly or posterior brachycephaly, because it's the same thing. If we are talking about posterior, that means we are talking about lambdoid synostosis, lambdoid problem, lambdoid suture early fusion. If I would have said it's anterior, therefore we are referring to your coronal suture, which we already discussed about. Now, about the lambdoid synostosis, there are two things which we must be familiar with. Lambdoid suture problem is the rarest one. It doesn't occur that often, but it can occur due to two reasons. Either the problem itself with the lambdoid sutures, just like other sutures, other craniosynostosis took place, or it can be due to position. Now, positional lambdoid synostosis is due to, suppose an infant due to, for an example, cerebral palsy, the child or the infant who doesn't move that often and can't move his head and stays in a specific position for a long period of time, that will itself cause a plagiocephaly. So it should be differentiated between for the clinical purposes, it's not that much important, but for the theoretic part, for the exam purposes, one must know lambdoid synostosis can be positional due to the long term staying on the particular position for long duration of time, or it can be due to your problem with the suture itself, which gets united too early. That's why it's called lambdoid synostosis. So in the case of if it's positional, we can call it lazy lambdoid also. The laziness. That's why it's called lazy lambdoid, because position in which the head was, the occipital part, remained in that position for a increased or longer duration of time. So here we can again see lambdoid. Now, one few things about plagiocephaly. Plagiocephaly, suppose in this case, suppose it is a lambdoid plagiocephaly on this side, flattening of the occipital part on this side. Usually, it will cause just flattening on this side. But if it's severe, then ipsilateral, for the compensation purposes, the bulging would be ipsilateral too, ipsilateral on the frontal side. Yeah. So this is all about the plagiocephaly if it's severe. So it can be a bit confusing. You can get confused with the plagiocephaly of the anterior part with the lambdoid suture, but it can be easily appreciated, because if it was this was just your suppose if this was your plagiocephaly on the coronal part on the left side, then bulging would have, as I already mentioned, bulging would have been on the contralateral side, but there wouldn't have been any flattening on the lambdoid area, occipital area. Since it is lambdoid craniosynostosis, therefore it will be a bulging on the ipsilateral side. So it can be easily differentiated. Uh, Plagiocephaly of the anterior part or the posterior part, it can be easily appreciated. Now, here is the diagram illustrating positional molding and lambdoid synostosis. Now, positional, as here we can think about a child has a child has been placed or has been in this position for a longer time, and therefore causing a molding or a flattening on this area. Yeah, flattening on this area. This is due to the positional, and here also now this one was due to the position and longer period of time placement of a child in a same particular area, particular position for a longer period of time. And this one is your due to problem of the lambdoid suture itself. So, in the if it is unilateral, the thing important thing is they are talking about the ear. The ear would be, suppose the ear over here always is placed, or forehead. Suppose this one is flattening over here. Forehead is bulging on this side. Forehead is bulging on this side. Now, ear also will grow or will be located anteriorly and inferiorly to the contralateral. So here you can see in this picture, ear is anterior to this one, and it would be inferior also to this one. So suppose there's a problem with the suppose there's a lambdoid craniosynostosis. Here we can see lambdoid craniosynostosis or the flattening on this side, therefore causing your head to bulge in front on the ipsilateral side to the flattening. Your forehead is bulging outside, and plus you can appreciate your ear would be anterior and inferior to the contralateral side. Therefore, this is much more easy for us to differentiate plagiocephaly of the posterior or the lambdoid suture comparatively to your plagiocephaly of the coronal suture, because in that case ear won't be affected. Again, here we can see uh, same thing here. Too much early flattening has taken place. Now let's talk about oxycephaly. Now oxycephaly is before talking about the oxycephaly. Now brachycephaly can be due to the both side. Brachycephaly can cause your lambdoid suture also fusion both side. Then it would be posterior brachycephaly, therefore causing your head to be like a cup. Sorry, your head to be just like a cup. So these are the few things. Now oxycephaly is involving your many sutures, more than one or more than two sutures involving. Basically, the main one is your coronal suture. Always, most of the time, is involved in your oxycephaly. Due to that reason, what happens is if this coronal suture, along with other sutures, if they are involved, that causes your head to grow like this, like a tower. So here you can see a tower. So therefore, giving it a aspect of tower, and hence oxycephaly is also sometimes called as turicephaly. So your diameters are grown in such areas like it's grown vertically over here, and anterior posterior diameters has also grown, as we can appreciate it. And oxycephaly is the most complicated one, is the complex craniosynostosis, because it involves your many craniofacial dysmorphism syndromes also, like your Alpers syndrome, your Crozon syndrome, Lafayette syndrome, your fire, so which I will discuss in the later video. So let's talk about the mixed one. Easily we can appreciate. Now here we have a normal cephaly, normal head. Here we have the metopic synostosis. That means involving your metopic suture, giving it a triangle shape, triangle forehead. Here we can see a triangle forehead, easily appreciated due to your metopic suture, therefore called trigonocephaly or metopic synostosis. Bicoronal craniosynostosis, if it's bicoronal, that means B for B, therefore brachycephaly. And if we are talking about the coronal suture, therefore bilateral coronal suture has been fused over here earlier, therefore causing broad forehead. Yeah, so forehead in the bicoronal craniosynostosis would be broad forehead, easy to remember. Then we have unilateral coronal synostosis. If it's unilateral, therefore we are talking about plagiocephaly. Here we can see the left flattening of the forehead, therefore causing, for the compensation purposes, the contralateral side to bulge. And here we can see the bulging, and here we can see the flattening. So easily to remember, easily we can see this is your left coronal plagiocephaly or left coronal craniosynostosis. Then we have scaphocephaly. Scaphocephaly, we are talking about the sagittal suture. So sagittal suture has been fused earlier than it was supposed to be, therefore causing your diameter to grow anterior posteriorly more than it can grow laterally, therefore inhibiting your head growth on the lateral side. Instead, your head grows in the anterior and posterior direction, therefore causing it, giving it a boat shaped aspect. And see, anterior posterior diameter and the lateral aspect can be easily appreciated. Is it has grown comparatively very in huge diameter comparatively to your transverse diameter. Then we have lambdoid synostosis. Again, plagiocephaly. If we are talking about the plagiocephaly, that means we are talking unilateral part. And see, here we can see, here we are posterior left side. Here left side posterior plagiocephaly is posterior plagiocephaly, therefore causing your contralateral area to bulge over there. Depending on the which side, it can be brachiocephaly also. Brachiocephaly will give your cup shaped. Your posterior area would be flattened. Instead, like the brachiocephaly of the coronal area was giving here, it was giving your forehead to be broadened. Here, your occipital area would be broadened if it was brachiocephaly. And that's all. This is about the positioning of the lambdoid suture occipital area. Again, the same thing. Let's go on the next slide. Oh, that's all. So thanks for. In the next video, I'll be discussing about different syndromes related to these craniosynostosis. Basically, with the multiple synostosis, a present oxycephaly is related to many few of the syndromes. So hopefully, we will discuss about all the different syndromes related. All right. Thanks a lot. Have a good